World Population Day is being held under the theme Universal Access to Reproductive Health Services. Guyana is currently the Caribbean country with the highest maternal mortality rate, and to combat this situation, more emphasis will be placed on instilling proper reproductive health practices. Assistant Representative of the United Nations Population Fund, Ms. Patricia Lafleur, says government needs to address the urgency and importance population plays in human development. Ms. Fleur noted that the maternal system in Guyana has been of a very low standard, and this, she says, is due to the government not investing in the country's maternal care system. She says the UNFPA will provide the proper reproductive health practices for health workers as they try to combat the rise in Guyana's mortality rate.
Giving birth is typically the most joyful moment in a woman's life. Yet, this very process takes the life of so many women worldwide. Every day, some 800 women die in pregnancy or childbirth from complications that are very often preventable. And for every woman who dies, around 20 more suffer debilitating childbirth injuries, such as obstetric fistula. We already have an international consensus on how to address that. All we need now are resources and accelerated and sustained action.
Minister of Health Dr. Barry Ramsaran says the United Nations Population Fund has over the years provided strong support to Guyana. Dr. Ramsaran acknowledged that Guyana's maternal system is currently facing challenges. However, Minister Ramsaran is optimistic that with the help of the UNFPA, Guyana's maternal system will develop.
Now, some of the intervening causes could sometimes be due to teenage pregnancy, and that's an area which I think we're neglecting. And I suggest that, again, when the UNFPA colloquium comes up, I'm told it's going to be sometime later this month, that we put that as a front burner issue. There's several reports which we should be scrutinizing, but for whatever reason, sometimes we stick in our necks or heads in the sand. Our school age in school population is aggressively sexually active.